Good evening. Good evening, and thank you all for joining us for this week's Community Leader Call. My name is Tomas Talmonte, Deputy Chief of Staff to Mayor Bowser. We want to thank you all for joining us for this evening's call. We'll be joined by Dr. LaQuandra Nesbitt with the D.C. Health Department, as well as our Homeland Security and Emergency Management Director, Christopher Rodriguez. And we also have our Director for the Mayor's Office of Community Relations and Services, Julia Irving. Thank you, Director Irving, for joining us. As Director Irving wants to remind that we do have directors and deputy mayors out talking about the budget at ANC and Civic Association meetings. So today we're going to focus on the mayor's announcements related to reopening for Phase 1, as the mayor announced today during her daily press conference. And we'll hear from Dr. Nesbitt on that shortly. But again, want to remind everyone that we are also in the budget process. As you all have seen, many directors have already begun their hearings related to their proposed budget for fiscal year 21. And as I stated a little bit ago, we also have directors and deputy mayors out speaking on the budget at community meetings. So if you're trying to figure out how to get engaged or get involved at your ANC or civic association, we have a full list of meetings and how to join them virtually at coronavirus.dc.gov/ANC. So we'll hope you'll go there and see how you can stay engaged as we talk about FY21 proposed budget. And you can also visit budget.dc.gov to get all of the proposed budget and our ward-by-ward investments that are available for you to review. But we will now focus on COVID response and recovery in the district. As I stated, Mayor Bowser today announced that the mayor's order will be lifted. When the mayor's order signed today, will lift the stay-at-home order beginning Friday, and we'll move into Phase 1 of reopening. And so to talk us through that, I'm going to go to Dr. Nesbitt, who will get started. If you have any questions, you can start to press 0 now to get entered into the question queue. We'll hope to dedicate most of today's call to questions. But now we'll hear from Dr. Nesbitt.
Thank you so much, Tomas, and thank all of you for joining today's community call. It's great to be back with you all this week after last week's budget town hall. My team and I here at DC Health have been monitoring health and readiness metrics to inform the timing and movement into our phased reopening here in the District of Columbia. More specifically, we have monitored sufficient public health system capacity, sufficient testing capacity, sufficient healthcare system capacity, as well as a sustained decrease in community spread. The goal of these metrics is to ensure that the outbreak is transitioning from widespread community transmission to a decline in transmission to localized transmission and eventually more isolated clusters and sporadic cases as we transition through various stages and phases of our phased reopening. And the district has the resources to identify, monitor, and respond to all positive cases as they emerge. Thresholds for moving into each phase will be established, as well as triggers that will necessitate a reevaluation of the current phase that we are in. Today, we reported a 14-day sustained decrease in new cases in the community. The health system's capacity is at 75%, which is below the 80% threshold. Testing is currently available to anyone who needs a test in the district at free testing sites throughout the city. And we are currently working to meet our goal of having a sufficient contact tracing capacity by June 1st. As a result, during today's press conference, Mayor Bowser announced that the current stay-at-home order will be transitioning into a different posture as of May 29th, and the opening of non-essential businesses for curbside retail, barbershop and hair salons, parks and open spaces for additional recreational activities, as well as restaurants for outdoor seating will occur. Healthcare providers will be able to resume some healthcare procedures that they may have opted to suspend to be able to preserve COVID-related resources. as well as elective surgeries. While the stay-at-home order will be lifted, the public health emergency will still be in effect, and gatherings of more than 10 people remains prohibited in the District of Columbia. As we move into phase 1 of reopening the city and it begins to warm up outside, you should still continue to practice social distancing and wear a face mask or face covering when social distancing cannot occur, including in indoor spaces such as your essential workplaces, doctor's appointments, and when you are participating in essential activities such as going to buy your groceries. We also ask you to continue to take preventive measures such as avoiding close contact with people who are sick, staying at home when you are sick, washing your hands often with soap and water for at least 20 seconds, and using an alcohol-based hand sanitizer that contains at least 60% alcohol if soap and water are not available, avoiding touching your eyes, nose, and mouth with unwashed hands, covering your cough or sneeze with a tissue and then throwing the tissue in the trash, and then cleaning and disinfecting frequently touched objects and surfaces. Lastly, I want to highlight the district's testing sites and provide a few updates. In addition to the district's testing sites, we have a number of locations throughout the city where you can receive testing for free, and that information is available on the coronavirus.dc.gov website under the testing tab. Currently, testing is available at United Medical Center and University of the District of Columbia Community College's Bertie Backus campus, Monday through Friday, for anyone who needs a test. Beginning June 1st, the United Medical Center location will close and be replaced with a new Anacostia testing site at 2241 Martin Luther King Jr. Avenue Southeast. This change in location is to ensure that testing sites are located in more accessible areas that permits walk-up testing and is closer to metro locations. The days and hours of operations at the new Anacostia testing site will continue to be Monday, Wednesdays, and Fridays between 10 a.m. and 2 p.m. In addition to the relocation of the Anacostia site, we will also launch a walk-up only testing location at 5th Street Northwest in Chinatown on 5th Street Northwest. Or I want to make sure we have that right location for you all. This site will operate Monday through Friday between 10 a.m. and 2 p.m. To schedule an appointment at any of the district sites, you can call between 8:30 to 4:30 p.m. Monday through Friday at 1-855-363-0333 for English and 1-844-796-2797 for English and Spanish. For more information on testing, reopening, and about the district's response to COVID-19, visit coronavirus.dc.gov. And I'll turn it back over to Tomas for us to be able to take questions.
I believe we have the mayor on the line now. Mayor, if you wanted to add any points there.
No, thank you, Tomas, and thank you, Dr. Nesbitt. Can you hear me?
Yes, we can, Mayor.
Okay, I just wanted to dial in. I have a couple of minutes where I can listen in to some questions and simply remind everybody on the call that we are able to begin a phased reopening, which is, I call it, I don't know if you've already talked about it, but it's like the stay-at-home order light. It allows people to go out. We continue to prohibit gatherings of more than 10. And we continue to focus on social distancing, wearing a face mask, and washing your hands. So I'm happy to answer any questions.
Thank you, Mayor. We will go to our first question. I just want to remind everyone, again, if you have a question, you can press 0 now to be entered into our question queue. And we will go to our first question, which is from Angela McKinney, who's calling us from Ward 6. Angela, your line is unmuted.
Okay, yes, hello. Thank you, Mayor Bowser, and I know you've been working tirelessly, and so, may God bless you. Thank you, Dr. Nesbitt, and everyone on staff. My question is, I know initially we were going to be on lockdown until June 8th, but now it seems like you're going to go ahead and do a soft launch or phase one starting this Friday. And my concern is, last weekend, there was a party in Southeast for the Memorial holiday weekend, so I'm expecting in 2 weeks that the infection rate is going to go up.
Is that a question for us? Hello?
Yeah.
Did we lose her?
No, Angela, you should be unmuted.
Can you hear me?
We can hear you.
I can hear you now. What was your question,
Angela? So my question was, we were going to be quarantined until June 8th, but you're doing a soft launch this weekend. My concern is, last weekend there was a party, the Memorial holiday weekend out in Southeast. Perhaps we should continue to be on lockdown to see if the infection rate is going to go up.
Oh, I got your question. So, and I extended the stay-at-home order back on May 15th to June 8th, and I also said then, Angela, that it was entirely possible if the data suggested that we could, that we would lift the order before we got to June 8th. And today, we reached one of our very important metrics, and that was 14 days of sustained decrease in community transmission. That's why we're moving into this phase. And it is also true that we have to continue to social distance, be mindful of our hygiene, and wear a mask. Because we know when people begin mixing again, they could be exposed to the virus. That's why we also continue to remind people not to have large gatherings of 10 or more. So you saw a party in Southeast. We saw people out on the boardwalk in Ocean City. We saw people on the beach all over the place. So we know that we can have more infections. So saying that we're moving into phase one doesn't mean that we're never going to see any new cases. It does mean, however, that our system can accommodate it and localize it and isolate those cases so that we don't have growing spread. And that's what we have to continue to do.
Thank you, Mayor. We're going to go to our next question. It's from Maria in Ward 5. Maria, your line is unmuted.
Yes. Hello, everybody. Thanks for everything you're doing to help with this pandemic. I'm a senior, and I was wondering if you have a more easier or more sensible test for a senior to take, because I have allergies real bad, and for the sick something way up my nose, it wouldn't be good for me. So I was just wondering if you had a more simple testing that you do for seniors that's not as harsh as the one that they're giving.
Okay, I'll let Dr. Nesbitt take that one.
Hi, Maria. The current test that diagnoses whether or not you have an active infection or current infection with SARS-CoV-2 that causes COVID-19 is the nasal swab. And so the test that the doctor gives you that has to go into the nasal passages, deep into the nasal passages, is the test that is required. There are some facilities now that are allowing individuals to do self-swab, which does not require as deep of a swab as the deep nasal passages. It can do the front of the nose. There are some concerns as to whether or not an accurate or a good specimen can be collected with self-swabbing. And so you run the risk of having to go back and swab yourself if you don't do it well enough. But those are the two options that you have. Now, it's not what we call contraindicated, or it means that people who have allergies can have a nasal swab. You just have to kind of hang in there and get it done. And so plenty of people, tens of thousands of people in the district have gone through this process, including people who have allergies. What I will say is that if you need a test, the risk of delaying getting the test could definitely be harmful if you delay. So we want everybody who needs a test to go out and get a test using the current tests that are available.
Thank you, Dr. Nesbitt. We'll go to our next question from Ms. Turner in Ward 5. Ms. Turner, your line is unmuted. Ms. Turner, go ahead. Your line is unmuted.
Yes, good afternoon. Hello, everyone. My question was, as far as the phase one is concerned, will recreation centers and outdoor sports for the youth begin to reopen in this phase, or will that still be on hold for a little bit longer?
I think I heard the question about recreation centers being open, and we are able to open the parks and outside facilities in phase one. We're not able to open the recreation centers or pools or playgrounds for concerns about how the virus spreads.
Thank you, Mayor Bowser. We'll go next to Ms. Joyce Jackson in Ward 8. Ms. Jackson, your line is unmuted.
Hi, Mayor, and thank you for having the meetings weekly. So my first question is, because we just had two, on Saturday and Sunday, there was 2 outbreaks, and I think there were over 100. So are these being counted, or is the person supposed to die and then you count it? And then the other question is, so where I live at, they never do social distancing. I've sent you an email, Eleanor Holmes. I've sent the chief of police. I've went to my substation. I've contacted my AT&T. They still play loud music, sell drugs, sell the bodies. So will the officers be out in Ward 8 giving people tickets? And where will the officers be wearing masks and gloves?
Well, thank you for those questions. And it sounds like you have some serious policing issues that are inclusive, but also well beyond what we're talking about with combating COVID-19. So what I'm going to ask Tomas to do is make sure we collect your information so that we can have the commander talk to you in more specificity about your concerns.
Thank you, Mayor. We will follow up with Ms. Jackson at the conclusion of the call. We're going to go next to Ms. Andrea Herman. Ms. Andrea, your line is unmuted.
Yes, hello. Good evening to everyone and Mayor Bowser. I had 2 questions, and one, I wanted to know about the limited child care opening. Can you further go in details about that? And also, when should daycare be expected to open back up? Was it phase 1, 2, or 3?
Dr. Nesbitt, can you speak to that? I don't have our child care guidance right in front of me.
Sure. So we've been able to provide guidance for child care facilities. It will be posted on our website at coronavirus.dc.gov phase 1, consistent with the guidance provided by CDC. To date, we've had child care facilities that have operated in the District of Columbia to provide child care options for essential workers, including healthcare professionals, first responders, and employees who work in what we call the critical infrastructure sectors, so those who work in our food retail establishments, et cetera. And those child care facilities remained open in our what we called phase 0, which is when we were in the stay-at-home posture or our current posture, to be able to provide options for families. We know that as we begin a phased reopening and non-essential businesses become operational, that more district residents and more district workers will need options for child care. And so the guidance that we have given to child care facilities allows them to be able to expand who they are serving in terms of district workers and do it in a way that can help to reduce the risk of transmission in those child care facilities. And so when you look at what we're recommending to child care facilities, it anticipates that they will increase their capacity to be able to serve district residents and workers who will now have to be called back to their place of business as part of the initial phased reopening in the district.
Thank you, Dr. Nesbitt. We'll go to our next question. David Magida in Ward 1. David, your line is unmuted.
Hi, thank you so much for taking the time. I'm the owner of Elevate Interval Fitness, and I've been in contact with a number of other fitness professionals and folks who have owned fitness studios in the city, and we all have the same general question. We're looking for a bit of clarity as it pertains to outdoor classes in these now open recreational spaces. If we keep it to groups of 10 or fewer people and practice as much safe social distancing as we can, are we now being allowed permission to begin outdoor classes so we can start to resume business for all of our members? And if with that, are masks required as well? We're looking for a little bit of clarity on that.
Well, that's a great question, and that may be something we need to issue some guidance on. It sounds like I don't think we have anything that would prevent that as long as it's not a contact sport. So let me take that question and scour our guidance and see if we need to issue some clarifying guidance on that.
Thank you, Mayor. We'll go to our next question with Ms. Sunshine Haven. Ms. Sunshine Haven, your line is unmuted.
Hi, yes. I was wondering if you're going to be opening up the transportation such as buses and Metro more.
Thanks for that question. And Metro is also has a phased reopening plan that's trying to match up their service with ridership. And as people come off of telework, I think that's when we'll see the biggest increase in service. But we are also working with them on supplemental service, especially for essential workers and late night workers. So we're monitoring where our needs are so we can communicate that with Metro.
Thank you, Mayor. We'll go next to Deborah Stevens. Deborah from Ward 1, your line is unmuted.
Thank you. Good evening. My phone broke up and I missed what Dr. Nesbitt had to say about elective surgeries. I have bad cataracts, so I'm really watching that, and I'd like to ask Dr. Nesbitt what she had said about elective surgeries.
Sure. In our phased reopening, healthcare providers will be making decisions about resuming some elective surgeries and medical and surgical procedures that may have been suspended as a means of preserving hospital capacity and COVID-related resources such as personal protective equipment. So your healthcare providers in this particular case related to cataract surgery, your ophthalmologist will be making a decision with you as to whether or not they have the resources now to provide you that particular surgery. So when you call your doctor's office to talk about whether or not now is a good time for you to have that procedure, you and your physician will make a decision about that now.
Thank you, Dr. Nesbitt. We'll go next to Miss Becky Burke in Ward 6. Becky, your line is unmuted.
Yes, hi. We've been hearing a lot about asymptomatic transmission, and I was wondering if there'll be tests available for people who don't have any symptoms, but who...
Yes, Becky, thanks for that question. And as Dr. Nesbitt previously explained, if you need a test, call one of our centers, call your doctor and explain the reasons why you need a test, and you'll be scheduled, or you can walk right up to our downtown location.
Thank you, Mayor. We have time for just two more questions. We're going to go next to Ms. Justina Wilkins-Jordan in Ward 7. Justina, your line is unmuted.
Hi, good afternoon, everyone. I have a business in Ward 7, which is a beauty salon, and I didn't get the phase 1. I want to know if we're part of the phase 1. And also, is it true that the virus no longer lives on the surface?
Let me start with, yes, you are in phase 1. Beauty salons may open for hair services by appointment. You may have one customer per licensed stylist and no waiting in the salon. Those are the basic rules. There's also, we're putting together some care packages for businesses that are opening in phase 1 that include gloves and hand sanitizer, bleach, and some other things. So you can reach out to the Department of Small and Local Business about that. And Dr. Nesbitt has also issued more specific guidance about how you should be operating to keep yourself and your clients safe. The stylist and the customer should be wearing a mask at all times. And the DOH guidance will further explain. Dr. Nesbitt, do you want to add anything?
So the guidance that we issue makes recommendations in terms of how often you should clean and sanitize your equipment, how often you should clean and sanitize your high contact surfaces, and the frequency by which we make those recommendations is based on whether or not the virus can be present on high contact surfaces. And to sort of give a very scientific and technical answer to that question, virus has been detected on surfaces, and depending on the type of surfaces determines the amount of hours that it's been detected. There's still a lot that we are trying to learn as to whether or not the presence of the virus on that surface determines is whether or not it is active virus, meaning that it has the potential to infect folks. But even though we know that, we still have this recommendation that we make with you in terms of the frequency by which you should be cleaning your surfaces. So in your barbershop, cosmetology and barbershop guidance that's on coronavirus.dc.gov under the Phase 1 tab, you'll get some specific recommendations from us in terms of how to conduct your business in the first phase of reopening.
Thank you, Dr. Nesbitt. And we've actually reached our time for today's call. But before I pass it to Mayor Bowser to close it out, I do want to remind everyone again about the site, coronavirus.dc.gov/phase1, or by going to coronavirus.dc.gov and clicking the Phase 1 tab. We not only have the copy of the full mayor's order, but all of the guidances that have been issued by DC Health related to Phase 1, and we'll continue to update those guidances as well as provide an FAQ for any questions you have related to our Phase 1 posture and operation. So just want to, again, remind you all about that site where if we didn't get to your question, a lot of your questions can be answered by visiting coronavirus.dc.gov/phase 1. And we'll be here again next Wednesday at 5 o'clock, and we'll answer any other questions related to any other questions you may have. So, Mayor Bowser, is there anything else you want to add?
No, that's it. Thank you, everybody, for tuning in.
Thank you, everybody, and have a great Wednesday.